Patient comes from floor and nurse meeting RN gives report to nurse Plummer LPN.
Hello, Ms. Palmer. How are you doing today?
Good, how are you?
Doing good. We just got a new admission from the ED, Mrs. B. She came into the ED last night. She's been having sticky black tarry stools for the last 3 days, accompanied with lightheadedness and fatigue. She does have a history of an ulcer, but nothing that's been in the present to bring any concern up to her. She does take NSAIDs for back pain and has also added 1 aspirin a day for prophylaxis for cardiac reasons. Her heart rate was 110, blood pressure was 120/80, and it does decrease to 90/60 when standing, so she's got that orthostatic hypertension. So be careful getting her out of bed. Maybe just do a bedpan for now. Respiratory rate is 20, oxygen 95%, and temperature is 36.8. She's being admitted for, they're trying to rule out possible for GI bleed.
Okay.
And then you're gonna have a student nurse following you.
What you reading in there?
Just a little bit of this and a little bit of that.
Oh, yeah.
Just looking at these necklaces with my husband can't afford it because he's broke.
Oh, no.
What you talking about me like that for?
Ain't nothing but a cheetah.
Yeah, okay, honey.
Okay. All right, your blood pressure is good. It's 120/80.
Okay. So I'm not dying.
Nope.
Awesome.
Hanging in there. And your oxygen. Ma'am, I think your husband's getting a little frisky over here.
Just keep on. You don't want to get nobody else chlamydia, honey. Yeah,
I
just
never
what
gave
you
you
know.
chlamydia.
He gave me chlamydia.
Stop telling everybody that. Oh, no. I'm so sorry to hear that.
I'm sorry too. He's on his way out though. You can tell. Hair falling out everywhere.
Oh, that's sad. How long have you guys been married?
We've been married 20 years. It's not that sad.
Oh. Well, that's great. You just put this under your tongue.
How long you been working here, honey?
No, no, just a couple years.
Excuse you.
Okay, let me take your pulse.
Or you can take my pulse.
He's very friendly.
He is.
My heart's a fluttering.
Sorry, he's on his way out soon.
Oh.
Woman, would you stop saying that?
Ready to meet your maker. Sick of him.
Okay, it looks like I'm all set here, and I'm just going to report that to your nurse. Can I get you anything else?
No,
You give me something.
Oh, I think you need to keep him under control.
Are you waiting for them to kill me? Did you not get what he said? There's a big screw loose inside you. I will rip it out of your head. As a mad dog on the rampage. If you think you'll change, save your breath.
Miss B, I'm gonna go ahead and check your abdomen. Let me know if you're having any pain. Okay, all set. Bowel sounds are hyperactive.
So Tashana LPN goes into the medication room to prepare medications to be administered. The medications listed are hydrochlorothiazide, aspirin, ibuprofen, amlodipine, and over-the-counter Tums.
Thank you for calling, nurse. I will discontinue the aspirin, over-the-counter Tums, and ibuprofen. I would like to start her on a PPI of Nexium after the EGD with biopsy is completed. Please make certain the lab tech comes to draw a CBC panel, BMP, and a PT. Patient can remain on a lactate ringer IV solution until NPO is lifted. She will need to remain NPO for 8 hours before the diagnostic procedure. I will place an order for all these things. But I'm also concerned about his alcohol use and smoking with the ulcer. Please call his PCP if any additional referrals are needed. Thank you.
Okay, thank you, doctor. I will update the hours to the changes and we will implement the next medication after the completion of the diagnostic study. We will also start NPO for 8 hours as soon as the order is received. Good morning. What's your name and date of birth?
The hell your problem is?
Can you just tell, it's casual Friday. Can you tell me your name and date of birth? We gotta get this done.
What's
All
your
right,
problem?
All right, good. Okay, so you got some labs you need to get done. So I'm Colleen, I'll be the lab tech in case you didn't figure that out yet. So I'm gonna need which arm? This one?
No,
Which
actually
one?
it's this one.
This one? All right. Do you have any allergies to latex?
No, ma'am. No,
Nothing?
no.
All right. Let me just get set up here.
What time you get off, Miss Colleen?
As soon as I'm done with you.
That camera's sitting up in here in this room.
I'm sorry, you said you wanted a 14 gauge is what you just said, or no? What did you say?
I don't like
didn't hear.
needles. So try to give me the
Well,
smallest one
listen,
that you got.
you're not going to like them any more in the next couple minutes than you like them right now. So let's just get this done, right? Right. All right.
Who hired you? Let me know so I can have them fight.
Listen, I don't report to you. I'm just here. You got to get this done. Listen, you like to drink and smoke. That's why you're here, lady. I'm just here to draw this blood, okay? You're going to feel a pinch, right? Oh, that's not a good one. I'm sorry. Ooh, I'm sorry. You're right. All right, that looks good. Hang on now. Let me get that one.
Excuse you.
All right. Ready? 1, 2.
Ow!
On 2. Ooh. All right, great.
You better be lucky I
We
ain't
got
got
this.
enough stress and I don't
Doctor
go
will
to
be in
jail.
shortly, okay? Oops, here. Don't touch it now. You get an infection. Here. Get you. There you go. Hold that on there, okay?
You ain't gonna tape it, you just gonna leave.
10 hours later.
Alright, so go ahead, open up your mouth wide so you can come out. Alright, so that's good. And you've got some juice here. Are you thirsty? Yes. Alright, little sips, okay? Good afternoon, Dr. Duggar. As you know, Ms. B was admitted yesterday for some black starry stools and nausea and dizziness.
Yes, Nurse Meany, I have spoken with Dr. Babb and he states the H. pylori test was positive. He placed an order for tetracycline 500 milligrams 4 times a day, taken with meals and at bedtime for 14 days. Let the patient know that we need to make sure that she is safe and determine her gag reflex has returned. She can start on ice chips. I also think it would be best for the patient to talk about her alcohol consumption with someone. Please ask social work and dietary to come up and help with supporting the individual, maybe offering a support group and dietitian to notify of a specific low acidic diet.
Knock, knock, knock. Hello, Mrs. B. It's me, Christine again. Hi. Alright, yeah, can you just verify your name and date of birth? Thank you. Alright, so the doctor said you could have some ice chips for now. That's what we need to start out with. Alright. Well, this is your mimosa. We need to take this out of the room. And I also spoke with your primary care provider, and they want somebody to come in and talk with you about your lifestyle modifications.
Okay.
Alrighty.
You guys just taking everything from me.
I know, but you know, with the alcohol and the smoking, the stress can worsen that gastrointestinal symptom that you've been having. It can.
I am pretty intelligent. You told me that my blood pressure is low and my heart rate is high because I'm bleeding from my stomach, and this is an emergency situation.
Mrs. B, the doctor has also prescribed tetracycline. It's an antibiotic specific to the bacteria in your stomach called H. pylori. It can cause some stomach upsets like nausea, vomiting, diarrhea. You also need to look out for white patches and sores inside your mouth. And it can also cause some vaginal itching or discharge. The doctor also prescribed Nexium. This is to help reduce the acidity in your stomach in order for your stomach to heal. For that one, we're going to need to watch out for a headache, some abdominal pain, constipation, and some drowsiness.
So I need to be near a bathroom just in case I need to watch for a yeast infection and a possible headache.
RN calls for social work and dietary to meet with the client. Nurse Meany speaks to the client regarding proper, whatever this is, coming up to speak with him regarding getting him some assistance with management of his health. Cue dietitian Bree.
Knock knock. Hi, my name is Brianna. I would like to discuss with you some dietary changes that your primary care provider would like you to be aware of. So, considering what you got going on, we want you to try to stay away from like acidity foods. We want you to try to stay low sodium and high protein to kind of help with that bleeding and get you to healing and feeling better.
Oh, so does that mean I can't eat my pickle sausages?
We would
love
like
my
you to
pickle
stay away from that or try to at least cut back on them. I have some information for you here. I don't know if you'd be willing to read through it if you want to kind of go through that together. Or even take some time and let me know if you have any questions. I am looking forward to setting you up with an outpatient nutritionist to see regularly so we can get that kind of.
Wait, so what time? Because I got bingo during the day and I cannot miss bingo.
Okay,
That's
well,
just
I'm
taking off
sure
of
we
bingo
can
time.
work around bingo. To health, is our priority here, and we'll get you to bingo.
All right, so what can I eat?
All right, well, let's go through this.
Okay.
So 50% of the world's population, it causes stomach inflammation. So that's not what we want. So we want foods, kind of blander foods for you.
Ooh,
Yeah.
bland.
Yeah, so we don't make that GI tract rough, like roughage, such as, raw vegetables. We want to kind of steer away from that.
Ooh.
If you have vegetables,
Funky
make sure you
hard.
cook them.
All right.
Okay. Just kind of go through this. A high-fat diet has been shown to increase stomach inflammation, so try to stay away from high fat as well as that high salt, as I mentioned prior. Low sodium will be good to go.
So does that mean no fried chicken?
I would steer clear from the fried chicken. I know that might be a little hard,
Yes, very,
but
very hard.
at least cut back.
Alrighty.
All right, so I will give you some time to read over that. Okay, let's try to read this. Yeah. And then I will give you some time to read.
Time to get it. Do the CJ come with us. Do the CJ come with us. Do the CJ come with us. Do the CJ